Yeah, clear is pretty good. This is Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Right now you can see that blue cannula to the left of the biceps. And as we look at the biceps, it's torn right here. And so we're going to go ahead and pass a spinal needle. You see it right there. The other thing we can see is that the biceps insertion into the glenoid, into the labrum, this is torn too. Normally this edge shouldn't look like that. And so this is just a sign of wear and tear changes. Hold the camera here. It's a slap lesion, but it's really more of a degenerative slap lesion. It's not the same type of slap lesion where we talk about fixing this in a young throwing athlete. Nonetheless, this can still hurt, and that's why we're going to do a biceps tenodesis here. So first we're going to pass a relay through. Put two hands on the scope for me. Put that. And get me right in the middle of the screen. And a grasper. And what we're using this for, this is going to allow us to pass a suture through the biceps and then to cut the biceps inside the joint. So right now we'll take that, we'll take a suture, and we'll go ahead and load that super shuttle. Now there's two different, well there's more than two, but there's at least two ways to do a biceps tenodesis. You can do a soft tissue biceps tenodesis, or you can use a suture anchor. There's other ways you can even just put it into the bone directly. And with what we're planning on doing right now, it's either going to be a soft tissue biceps tenodesis or a suture anchor. But right now we're going to place another needle through the biceps. That looks like a pretty good spot right there. And then we're going to hold the camera here now. We're going to pass that relay through one more time. Pause, please. Okay, so we've released the biceps. That's the edge of it right there. And once we do that, we usually do not have to do anything to secure the labrum. That's going to be just fine. If it's really, really bad or it's torn in addition, then sometimes we'll put an anchor down right here separately, but I don't think we have to do that here. So next we're going to look up at this huge rotator cuff tear. It's actually hard to show because there's nothing here. There's just a hole. And so as a result, we're going to go ahead and get to work on this from the subacromial space. Okay, so now we're getting a pretty good idea of this tear. You can see it there. Our camera's in the lateral portal. Posterior's on the right, so that blue cannula you see there is coming in from the back. Anterior's on the left. So right now we've just got 3 cannulas in. When we place our Biobrace, we're going to add a fourth yellow cannula. And there's the cut edge of the biceps tendon. We'll be dealing with that too. So next step though is to go ahead and start to repair this rotator cuff and get as much of this fixed as possible. We're going to do a ripstop stitch first because it'll give us a little stronger repair. So that's going to mean passing a suture basically across the apex of the tear right in that direction, like between those 2 blue cannulas. Okay, hold the camera. Okay, so we've got the cuff repaired. We haven't placed our graft yet, but at least you can see the cuff repair. And that looks pretty solid there. Now we're going to place a graft over the top of that. In order to do that, we need to make some measurements here. And that's what we're about to do. Okay, so it looks like if we go all the way up to the biceps, which is right there, that 22 millimeters, which is the width of the graft in one dimension, is just about perfect there. We'll look at what 3 centimeters looks like here in a second. So if we get this to come down to about here, that's going to be 1 centimeter there. 2, 3 is all the way back to here, and the mid portion is right there. So like always, we need to get back pretty much as far medial as we can get. We'll show you some more in a little bit.